Hello. My name is Jared LaRusso. Today is August 2nd, 2024. This is my piece of paper, all the bones on it. So, let's kind of get into this. Um, so first, we're going to talk about some of the different components of the skeletal system. Obviously, mainly we're going to be talking about bone, but there are supporting structures like cartilage that can eventually become bone. It's often like replaced by bone, um, or it helps form things like our ears. Ligaments and joints, which help to kind of connect bones to bones, or bones to muscle. Um, kind of helping us with movement and whatnot there. Um, Next, we can kind of talk about the some of the classifications of bones. Or actually, let me go back. I'd actually like to talk about osteocytes, which are the main functional unit of the skeletal system. They are formed by osteoblasts, which are the main stem cell of the skeletal system. Um, and osteocytes can actually be broken down by osteoclasts, and that actually happens over a period of several years to our bones. So skeletal system is constantly in a state of breaking down and building back up again. So with the osteocytes and osteoclasts. Um, Next, we can kind of talk about the different classifications of bone. There are things like long bones, like the humerus or the femur, as well as short bones, like the tarsals. Um, we also have things like irregular bones that um, like the vertebrae or the oscoxa. Um, then there are things like flat bones. Goodness gracious, flat bones like the sternum, or special bones like the sesamoid bones. Um, yeah. So let's kind of jump into this thing really does not want to function today. Let's kind of talk about some of the bones here of the human body. Frontal bone, starting off. Of the skull. Parietal bones, two of them on the side. Two temporal bones, one occipital bone in the back there. Um, then we can kind of go over to the side view here. Not really going to be visible as well as if we had like an inferior view of the skull. But the ethmoid and um, sphenoid would be more visible on an inferior view. You can kind of maybe see the sesamoid bone. Sphenoid. Let's go over to the vomer here, um, as well as the zygomatic bone there, two maxillae, as well as two nasal um, bones, as well as lacrimal bones, um, with deeper, I would say, to the nasal bones are the inferior nasal conchae, um, palatine bones, in the palate kind of help form the palate there, or they do form the palate, not kind of. One mandible there for our friend here, as well as the hyoid in the neck. Um, Three bones form the auditory ossicles, the malleus, incus, and stapes. Um, and yeah, so I think those are all the bones of the facial bones as well as bones of the skull. Um, we have 20, not 24, seven cervical vertebrae, as well as 12 thoracic vertebrae, um, five lumbar vertebrae, one sacrum, one coccyx there. Um, Cannot forget about the sternum. 24 ribs, 12 on either side. Um, Two clavicles, two scapulae. Um, and then we can kind of talk about the arm here. Um, Humerus, radius on the outside, ulna on the inside there. Um, Pointing the right thing. Radius, ulna on the inside. Um, let's go down to the hand here. Um, my arm's getting the cramp here. This is no good. Pisiform, triquetrium, lunate, scaphoid there. Um, Down to the hamate, capitate, trapezoid, trapezium. Metacarpals 1 through 5, proximal middle distal, proximal middle distal, proximal middle distal, proximal middle distal, proximal distal on the thumb. Phalanges, proximal middle distal, phalanges. Um, oh man, this really just does not want to stay. Whatever, not a big deal. Two hip bones, right there. Um, Two humerus. Fibula, fib's about being big in comparison to its friend, the tibia, as well as the patella, helping to protect our knee joint there. Calcaneus, I'm losing everything today. Calcaneus down to the talus, to the navicular, and the cuboid. Three cuneiforms going across over here. Cuneiform lateral, cuneiform intermediate, and cuneiform medial. Um, and metatarsals 1 through 5, metatarsals 1 through 5, um, as well as proximal middle distal, proximal middle distal, proximal middle distal, proximal middle distal for the phalanges, and then proximal distal for the hallux there. Um, yeah, that's our skeleton there. Um, God, this is really hurting. I'm just gonna hold my arm straight out. Let me talk about the clinical application, which is going to be the um, as as a nursing assistant, and I imagine as a future nurse, um, I've seen a lot of spinal fusions in my time, and those kind of often require a lot of rehab. Um, and so, getting back to um, normal daily living takes a little bit of time, especially when you undergo something as strenuous on the body as a spinal fusion, which is where they take um, sections of your vertebrae and fuse them together, fuse those bones together. And that often is kind of limiting on your mobility. And after having surgery, your body is going to need some time to um, get back to its um, normal state that it was before. And so oftentimes it takes a little bit of time for those patients to go through rehab and practice their daily um, activities of daily living. Um, and that, that takes time. And so it's definitely a worthwhile cause, like as a nurse and has been as a nursing assistant, helping people get back to their normal function. And so um, yeah, there's different kinds of fusions as well, not limited to the vertebrae, but that's often one that keeps you in the hospital for a long period of time just because of how strenuous it is on the body and how limiting to the mobility of a person it can be. So, um, yeah, that concludes my talk about the skeletal system. Thank you for your time. I appreciate it. Have a good day.